Ladies and gentlemen, we have the distinct pleasure of sitting down with Dr. Mark Hawass, a trailblazer in the field of regenerative medicine. As the founder and lead practitioner at Arthritis VIP, Dr. Hawass has dedicated his career to transforming the lives of individuals suffering from chronic pain and arthritis. With over 2 decades of medical experience and a relentless pursuit of innovation, he has developed the groundbreaking VIP Biohacking Method. Today, we will dive into his journey, insights, and practical strategies to help our readers lead a healthier and pain-free life. Dr. Hawass, welcome to Magazika.
Thank you very much for the introduction. I'm honored to be interviewed on your channel, and I going to make sure that we have the most impact for the audience in learning something new, never heard before. This is a new frontier of medicine. I'm excited about this interview.
Thank you very much. Dr. Hawass, can you share not exactly the exact moment, but what are the factors that influenced or inspired you, better to say, to specialize in regenerative medicine and chronic pain management?
Yeah, I'm going to start with my story that's going to lead me to this. And we're going to go back to 2001, long time ago. I graduated from Dalhousie University with double major in family medicine and emergency medicine. Got excited. It's been 13 years of studying. Now I want to practice. I want to put what I've learned into live. And I picked up a hybrid model between working in the family medicine as emergency medicine. 6 months on the dot, I got T-boned with a car accident. I thought nothing out of it. I went back to the hospital. They told me this is more muscle spasm. Here's some anti-inflammatory medication, muscle relaxant. I truly thought nothing about it because I thought, like, I've treated hundreds of patients like that. That's what we do day to day. But unfortunately, the 3 weeks lasted 3 months to about a year, year and a half. In between, I've used physio, chiro, massage, acupuncture with really variable results. So I wasn't getting any better about a year and a half into a post-car accident. So I had an MRI, and the MRI showed that I had disc herniation in my lower back, and the surgeon said, "Oh, we need to operate." Being desperate, I thought this is the light at the end of the tunnel. Let's go for the operation. And here's the thing, though. I was age 32 when I had this operation. I had the operation. The surgeon told me the surgery went successful. Come back in 3 months follow-up. I go back in 3 months follow-up, but my pain is still the same. It did not improve. So I talked to the surgeon about it, the neurosurgeon. He said, you had a disc herniation. I took care of that. I don't deal with pain. Go back to your family doctor. And to me, like, it was a shock because the reason I went because I had pain, not because I had disc herniation. I want to get rid of my pain. And now I had a surgery, but I'm back in the same place. I went to my family doc and we started on a journey of adding one pill after another. Within about 2 years, I was on between 5 to 7 different medication, you name it, between anti-inflammatory, muscle relaxant, painkillers, constipation pill, anti-acid pill, anxiety, sleep medication. And most of the audience that go through chronic pain will have some sort of that combo. And within 2 years, being on those combination of medication, I gained about 80 to 90 pounds. My life flipped upside down. So I wasn't able to do my daily activities, from even helping around the house, cutting the grass, shoveling the snow. I wasn't the husband nor the father I wanted to be. We had 2 kids at that time. I couldn't lift them, play with them. And impacted my ability to do any hobbies because I'm in pain all the time. Friends and family wouldn't associate with me because I'm always in pain, popping pills. And then it impacted me in terms of work. Staff didn't take me serious. Patients didn't take me serious. And the sad part, it destroyed my self-confidence and self-worth. And I lived in that doomy black era for over 11 years. The tipping moment that changed my life is when I was in the office meeting someone who had chronic pain. She was in 41, 42 years old, similar to my age at that time. And she asked me, Doc, am I going to get any better? I really couldn't answer her because either I'm going to give her a lie because I didn't get any better. I used the traditional things, the physical therapy and all the others. I used the pills. I had the surgery, but I'm not any better. So I couldn't give her false hope and say, yeah, you're going to get better. So it was an awkward, long silence between the two of us. I didn't answer her that day, went kind of distressed, not knowing what to do. When I went home, my wife looked at me and said, what happened? I told her the story, and she told me, well, we miss you too. You're not the same after the car accident. You're not the same after taking all those pills. So those 2 points in one day made me start the trigger on looking for different answers. And sadly, I felt in that moment the same traditional medicine that trained me has failed me and failed thousands of people, if not millions of people, suffering from chronic pain. So the journey led me to learn more about different arenas of medicine that were not trained under the traditional system, which is functional medicine, dealing with root cause of things, and regenerative medicine, which is about enabling the body to heal itself from inside out. That journey took me over 5 years and about $400,000 of out-of-pocket investment to find answers for me. And I was able to lose all the 80 pounds that I gained and maintain it till now. And I was able to get rid of all the medication, including the painkillers, which is really, really hard to get rid of. And I felt empowered again. Now I'm able to do activities, enjoy the family, enjoy sports that I've never been able to do before. I'm able to bike like 70, 80 kilometers. I couldn't do that even before my car accident. Now I'm back to feeling the husband, the father I wanted to be. And I got excited and say, you know what? Maybe this is my calling to do chronic pain management. So I trained to do chronic pain management. And unfortunately, what we found that there's a lot of limitation under OHIP. That's why we opened a private practice to use regenerative medicine and functional medicine to help deal with the root cause of chronic pain illnesses. So
That's a
it's a long journey, but that's here we are. This is almost like a 20, 23, 24-year journey of where we are.
but a fascinating one.
Thank you.
I bet it's a fascinating one. And it is fascinating, and more importantly, it is inspiring. The resilience you have shown after suffering for 11 years, and then also in search of answers for 5 years, that perseverance, that consistency, it's mind-bending. So the VIP biohacking method sounds, the name itself sounds very fascinating. So can you explain in brief that how this method works and what sort of makes it unique compared to the traditional treatments that you talked about right now, that it failed you, and chronic pain and arthritis? How is it unique compared to the traditional treatments, please?
I'm going to start with what the traditional medicine has advanced in. Traditional medicine in the last 100 years has done an amazing job in acute medicine. So acute infections we can handle, heart attacks, strokes, cancer, you break a bone, you have a cut. Traditional medicine has advanced dramatically in that arena. But unfortunately, the industry did not expect that there's a lot of chronic illnesses going to come from the lifestyle changes that we had over the last 100 years. So we have the highest in terms of arthritis, highest from chronic pain per capita, more diabetes, more obesity, more hypertension, more high cholesterol, and so forth. And the reason is the lifestyle that we embrace in the last 50, 60 years.
Yeah.
And the traditional medicines focus on acute emergencies, not on chronic illnesses. So when I got exposed to functional medicine, and that is the science of how can you deal with the root cause of things, which often lies into two systems to summarize, which is hormones that start declining after age 40, and it's almost a linear. So by age 40, you have 40% decline, by age 50, 50% decline, and so forth. And gut. and the gut is responsible for the immune system. And if the gut declines in function, that's when we start having systemic inflammation, autoimmune disease. The combination of the art of combination both, that's called functional medicine. On the third arm, you have the regenerative medicine, which the body's ability to heal itself from inside out. Like for the audience and for myself, or even for you, if you cut yourself, you heal. And that happens usually within a week or two. And the question becomes, well, how come I don't heal from my chronic pain? Well, most of the illnesses or chronic pain areas are related to ligament, tendon, and a joint, which often don't have a poor blood supply. So regenerative concept is, I want to take your own healing properties, optimize it first, take it from you. We do in the lab, isolate the healing properties. Our method, we concentrate it 7 times and re-inject it in the affected area. So in a nutshell, we're taking your own healing and reintroducing it to the areas the body is not capable of healing. So if you look at it from 3 arms, we have on one arm, we have the functional medicine. The second arm, we have the regenerative medicine. And then we have traditional medicine. The VIP biohacking method is more of a recipe combining the best of all those 3 to create that method. The easiest analogy, I say, it's all about the ingredients. Most people love to have tiramisu. Well, tiramisu has been just created in the 1960s by an Italian chef, and all of us like it, enjoy it globally. But the ingredients been there for thousands of years till someone came and created that recipe and it made it a product. That's exactly what it is, what we did. We find the different recipes, different arenas or arenas of medicine, combine it all under one umbrella to get the most outcome. And that's what we call it, the VIP biohacking method.
Oh, fascinating, fascinating. And basically, you are dealing with, in a nutshell, from a layman's perspective, it's pain, it's arthritis, and it's pain. So chronic pain or pain itself, what are some, because so many of our readers might be dealing with pain right now. So what are some common misconceptions about managing chronic pain that even you in your daily life, in your daily practice, you frequently encounter, and how do you address them? Misconceptions about chronic pain.
I was guilty of it too. I accepted my fate without challenging my doctor, even without challenging myself as a doctor. And that I lived in that darkness for over 11 years. And what the misconception is for patient is the doctor right now, whoever you see, is going to give you to the best of their knowledge. But it's our responsibility as a client suffering from chronic pain or any illness to seek the best for ourselves, whether we find it within your doctor, whether a different practitioner, a different field. That journey has to be upon us. And often I see patient, well, but my doctor told me so, and they stop right there. Oh, well, OHIP covers that, and they stop there. Or my insurance does that, and that's it. And that mindset often prevent people from pursuing their health to the optimal, getting rid of chronic pain, because literally it's about that mindset. I've been told so, and just live with it and don't explore any other options.
You have over, like, way over 1,000 clients treated at Arthritis VIP. Any particular memorable success story, without disclosing obviously any personal detail or anything, any
Yeah.
memorable personal success detail that highlights the impact of your work on a patient's life?
Oh, totally. We have a couple of cases I'd love to share with you guys. Rick,
Please.
he's 68. He came to us about 3 years ago. He was
Nice.
told he has bilateral knee osteoarthritis. He was told he has bone on bone based on the x-ray, not a clinical diagnosis. He has a company with 70 employees. He didn't want to go through surgery because that's going to put him off. He's not going to be able to run his company. With our VIP biohacking method, by the 6th visit, he was able to walk, not just walk normally. We got a call from him and we thought this is day 2 post procedure, that maybe he's having a side effect or something. He said, no, I just want to let you know, I just climbed the CN Tower, 144 floors within 21
Wow.
minutes. And imagine that person 6 months before, he could hardly walk around his factory, around the house, and now he's climbing the CN Tower. And the interesting part that we do, we follow our patients for over 2 years. And I got his information on Tuesday, literally 3 days ago, that was did it again, and it took him 24 minutes instead of 21 minutes. So, but he's 70 years old right now, right? And this is really empowering, because for someone who's told you need surgery, you can't walk, and now he's climbing
Exactly.
144 floors, that's an amazing impact.
Yeah, truly, truly. And
Yeah,
it's like almost a miracle.
it is. It is. I mean, it's one of our proud cases,
Mhm.
because he followed through as well, and I'm really proud of him as well. Often people fall off the wagon after a year or two, and it's just about lifestyle. After we finish the program, they need to maintain that lifestyle.
Yeah, that's a very interesting word you have seen. Regarding all the doctors that we speak, there is a common topic, common thread. It's a common factor. In one point of the conversation, it comes out, it's burnout. It's the
Yes.
physician's own burnout because it's a very demanding career. It's a very pressured environment and everything. So I asked this to, after a while, I realized, and I ask it every physicians, specialists that come to this podcast, that what is your strategy? Because your health is not a small fiat. So could you share some of your personal strategies to staying active and healthy in the midst or in the pressured environment and maintaining a very busy schedule, please?
The methodology that I use on me is the same methodology that I tell to my clients. We don't like to call
Oh,
them patients, and here's why: because it's more disempowering. It's no different than you and I. If I walk down the road right now and you sprain your ankle, you just not just suddenly from being a patient, being a person, now became a patient just because you sprained your ankle. So we're all individual beings. And if we look at it from a doctor-patient relationship, we're exactly the same. We face the same struggles, the same trouble and challenges.
yeah.
So one of the things that I say, and I'm going to deviate a little bit in terms of analogies, most of us flew on an airplane.
Yep.
And if the oxygen level goes down in the airplane, we get this oxygen max drops. And even if you
Yep.
have kids around you, the first thing that you need to do is put on yourself before you help your kids, even 3, 5 years old, or other dependent people. And I look at it from a doctor perspective. All the patients that we take care of, 1,000, 2,000, whatever that big practice is, we are in charge. And if I don't take that oxygen first and take care of my health, I'm jeopardizing the health of another 2,000 or 3,000 people,
Yep. For sure.
right? So it starts with basic things, honestly. Sleeping on time, waking up on time is the same time every day. So you pick up a time, the ideal sleep, it's between 10 p.m. Till 6 a.m. Plus minus an hour, that's completely fine. But the body likes to be regulated in terms of sleep. The reason I emphasize sleep, that's when growth hormone peaks at the top, and that's when healing and recovery happens, especially chronic
Oh,
pain or non-chronic pain.
oh,
Everything we do during daytime. So if you're a bodybuilder or you want to build muscle, lose fat, all that happens between 10 p.m. and 6 a.m.
wow.
If you sleep at 1 a.m., you lost 3 hour window of that healing, recovery, building, repair. So sleep is very critical. Number two, activity level. And activity level, often we consider ourselves as active, but when I did it on my Fitbit, we only got about 2,500 steps per day running in the office. Ideally, we should target between 7 to 10,000 steps. And that's what is going to help not just the cardiovascular part, it's going to help even the mood. Always emotion get elevated with motion, and the more you walk, intentionally. So you set aside, not just because you're busy in the factory or at work or at the clinic, doing resistance training at home. You don't have to do something strenuous. Even once or twice a week, that's going to help boost the growth hormone, and that's going to give you better energy, better testosterone level for male and female. And your food, I'd like to eat once or twice a day. Maybe it's not feasible for everyone to do that. I'd like to skip breakfast. Some people may call it intermittent fast. I play it by day. Often, if you eat once or twice a day, you're going to have more energy to focus on your work, to have more, you don't have that drop in energy after you have some carbs or some carbohydrate in terms of your food. So you don't have that crashes throughout the day. So you can maintain that energy throughout. So basically, to recap, it's about your sleep, walking every day, doing some resistance training once or twice a week, uh, figuring out what to eat. And in terms of the timing, once or twice, up to 3 times a day. Don't snack a lot. And the fifth one is, and it's major once you do that, no deep fried food, no processed food as much as possible. Even if you did it 80% of the time, you're just going to be just fine. It's gonna, if you follow those 5 steps, you're gonna feel an impairment in less than 30 days. And that's the jump start that we give to all our clients when they came in to transfer their life.
Fascinating, fascinating. And as you are saying this, this is very generalized advice. You say this to almost every patient and everything. But whenever you are looking at an individual, an individual is coming to you, because you don't like to call them patients. I like that idea very much. So when an individual or a person comes to you with any pain or anything, so that person is an individual person. So it is highly personalized and customized treatment plan you have to make. So how do you do that, or how you consider that factor in your treatment process?
When the patient or like when we say the client comes in and you want to embark on the full journey,
Mm,
we take a detailed questionnaire. And one of the first part when we help
wow,
with the wellness program
wow.
is we start on something called an elimination food. So we're going to bring the food back to the basics. We want basically a little bit of protein, some fruits. It's not enticing in the first 30 days, but that's going to bring systemic inflammation to the lowest. In the background, we do food sensitivity tests. That's very, very major, because now I know exactly what food is causing you the trouble. And often people we say, hey, but I eat healthy. I have knee pain. Tell me about your food, but I eat healthy. It's like, oh, what do you eat? Oh, I had chicken and salad. Well, what kind of salad? I had Caesar salad. That's fair. What do you have? I have salmon and some broccoli and some vegetables in the evening. But when we did some food sensitivity on that particular patient, they had sensitivity to lettuce. So
Oh,
yeah, but I wouldn't know. Like
yeah.
I'm felt like even when I did my own food sensitivity, I thought I'm sensitive to gluten, but I'm not. I'm sensitive to yeast. So I can have sourdough, but I can't have regular bread because of the yeast in it, right? Uh, I can't have, like, I used to love Thai food, but when we do it, like, always get upset stomach. It's because of the coriander. I'm sensitive to coriander, but that's the depth of what we go. So once they do the food sensitivity test and they did the elimination, now we're gonna customize their food plan, a recipe plan based on what those 2 parameters comes out. At the same time, we're gonna optimize all those hormones, fix the leaky gut, and work on the regenerative side.
So gut is a very important part of your whole treatment process.
Absolutely. It's the second layer. The first layer, we work on hormones. We want to optimize hormones. So it's like an orchestra. So
Oh,
there's
yeah.
7 hormones.
Mm.
Cortisol level is the stress hormone. As the cortisol level goes up, it suppresses all the other hormones.
Oh,
Literally, it suppresses the growth hormone that's helped with healing and recovery, suppresses the thyroid hormone and the insulin that's helping with metabolism. It suppresses the estrogen, testosterone, and progesterone. We call them the sex hormone, but they're very essential and vital for muscle and bone health. So
nice.
think about it this way. If you go outside right now to the parking lot and a bear start chasing you, and you have the stamina to run for months. And that gap between you and the bear stays about 1 kilometer. The first thing that's going to happen if you had a big meal, you're going to throw up. And people, even in the layman's term, they scare when they get scared. What do they say? You scared the shit out of me, because you poop and pee yourself, because it's not the time to digest.
Oh.
That's when the stress happens, right? Imagine you continue running and you're still eating food because you want to maintain for a month or two.
Mm.
Those patients will still gaining weight because it's not the time to metabolize. So they gain weight despite they're still doing physical activity. That's why often people tell you, I do everything at the gym, but I'm still gaining weight, because your stress hormone is or your stress level is very high.
Uh-huh.
Then do you think the body is going to be able to regulate those sex hormones? You don't have sex drive, period is going to go off irregular,
Yeah.
because the bear is going to catch up with you. What do you think is going to happen to your sleep? You're not going to be able to sleep because the bear is going to eat you, right? So your quality of sleep is going to go off. And what's going to happen to the healing and repair? Well, you can't heal and repair because you can't sleep well.
Yeah.
It's all a dominoes effect. The first thing, that hormone that we need to work on is reduce the stress hormone cortisol level. And we do that with either supplementation, because like an orchestra, it could be too high, we're gonna bring it down, could be too suppressed, and we have to bring it up. So we have to match the normal bell curve. And that test we do it at 4 point. And unfortunately, we have to send it to the US. We can't do it in Canada.
Oh.
So once we work on that stress, then we got to work on the metabolism hormone, which is the thyroid and insulin. Once you regulate that, now you're going to go to the sex hormone to build more muscle, more strength, more stamina. That's one phase, fixing, optimizing hormone. The second phase is to go and kind of optimize all the gut, because the gut is like a fortress, and that's where all the immune system lies. And as we go 40 plus, and with all the toxins that we ingest, that layer becomes, the immune system becomes very fragile. So we have leakage and gaps in the gut. That's what a leaky gut is. So toxins, bacteria go, and where do they hide? They hide in places where they cannot be found. So there's less blood supply, which is ligaments, tendons, and joints. And that's what chronic pain is all about, right?
Oh, wow.
Yeah. So we need to fix that leaky gut, bring the junctions together, put that immune system all solid, so you don't have that systemic inflammation. And
Mm.
now you have the powerful healing. Now what's left behind is using regenerative therapy, taking your own healing, because now your own healing is really optimal. If I took your blood before I fix your hormones and fix the leaky gut, maybe your healing properties were only about 30%. But because I optimize both those, your healing might be 80, 90%. So
Yeah.
that's why our regenerative therapy will last people 2 to 3 years versus a traditional PRP injection, plasma injection that people talk about without the method only lasts about 6 months. 6 months versus 2 to 3 years, right? Because you
Yeah.
fix the whole system.
Yeah. And if, as you mentioned earlier, that if after that people maintain that healthy lifestyle, it will like,
Oh, will last for, yeah, you put up. And here's the thing though, most people look at it from a chronic pain point of view. But often when you fix those infrastructure or the root cause, which is the hormones and the gut, the immune system, people lose 15 to 25 pounds effortlessly because everything is in sync. Not diet restriction, no Ozempic, no starvation. You eat properly because now we know what your food sensitivity look like.
yes.
You have the right food and you're going to enjoy it because you're not bloated anymore. Other part people think about it, we want them to feel good about themselves too. They're going to have the energy, the stamina. Funny to say, when we fix the gut on the hormones, skin will be more radiant because you remove the toxins from it. Your hair will look better. You look glowy, right? And you have the ability to more endurance. You sleep better. Your mood will get better, right? Most people with chronic pain feel cranky because it's affecting their mood. Now you have an elevated mood. And majority of those patients will reduce their pills by 50 to 70% because they don't need antidepressant, they don't need anti-inflammatory, they don't need the painkiller. So
Yeah.
as we improve that health, we start weaning those medication off, and that's the ultimate goal. That's what an optimal living, that's what an optimal healthy lifestyle look like. And interestingly enough, when we ask majority of our clients, what do you want? Oh, I just want to move. And once they gain that mobility, is, oh no, wait a minute, I want to travel, I want to play with the kids.
Yeah.
Then they get start have their more bucket list to do because they were so consumed. I just want to get rid of my pain. Now they open their lives, and most people give up on their life on the treatment once they hit 40, 50, 60-year old and say, oh yeah, I've been told to live with it for the rest of my life. You don't have to live that way. There's another way. There's a better way, right?
Yeah. So in your profile, we have seen that you are very actively engaged in road biking and hiking. So we have just talked about food
Yes.
sensitivity. We have talked about food sensitivity and everything. Just a bit more about what is the impact of that, because whenever it opened up, or before that even, whenever a person is not yet in pain, but there is a possibility of our sedentary lifestyle and everything, what is the role of physical activity? Can you stretch a bit more on that? Because you are personally engaged in road biking and hiking yourself. So please.
So activity is essence of life. I mean, when we die, we don't move. When we say bedridden, that's what disease is all about, right? If you want to preserve muscle mass, uh, put it this way: aging is all about muscle loss, and we lose
Oh,
one. Yeah, as we lose muscle, we become more fragile, and we might lose 1 pound of muscle every month we're not active. If you're bedridden, you lose 1 pound of muscle. And it takes 6 to 9 months to build 1 pound of muscle. That's if you're admitted to the hospital and you're bedridden. In
wow.
normal life, for you and I, we lose literally 1 pound of muscle mass per year. And that's what aging is all about. So physical activity is very critical in preserving the muscle mass, not just from circulation point of view. As I want the cardio part, the cardiovascular, that's when you do some walking, maybe biking, non-contact sports. I like it when we hit 40 and above because we're still prone to injuries. So I like to do non-contact sports like swimming, biking, hiking, walking for a long distance. And at the same time, we need some sort of resistance training to preserve the muscle. Because think about it this way, we've heard the term, if you don't use it, you lose it. So if I say, for example, go and do a bench press today, the body wants to not use the muscle of the chest because I put a lot of weight on it. To say, you know what, I need more energy, I'm gonna take it from the back muscle. But if in 2 or 3 days I did some back exercises, the body says, well, I can't take it, I need that muscle for the exercise. So, but yeah, I need to go and take the energy from some other source, and often the body's going to take it from your own fat. That's how you lose your fat.
Oh,
Because you're telling the body, I need those muscle because I want to use it, leave it alone. But if you don't use it, the body will go after it, and that's what aging is all about.
wow.
Right? So
That's-
so physical activity will prevent aging. uh, is going to boost morale because it boosts growth hormone, testosterone. That's people get hyped up after they go from the gym. All the dopamine receptors go up. So you feel energetic, better mood, better stamina. And the most important part of that at the end of the cycle is you will have a really, really good sleep. You remember the day when you do a lot of physical activity, you feel like you slept like a baby because you had all those endorphins. So yeah, it's all a full cycle, right?
Fantastic. Nobody explained aging in this way to me ever before. And it is so common sense. It is so common sense, basically. Fantastic, fantastic. So finally, but like whenever you are talking to regarding, for example, we are having this conversation. You are seeing people whenever your clients are coming in, you are seeing them. What is in the long run, and you have done this various times, you are doing tremendously nice job in your sector. So what is your future vision? Future means in the regenerative medicine, in the pain management, and how do you see these fields evolve? And in that evolving landscape, how do you see yourself contributing in?
The regenerative medicine field, interestingly enough, started back in the 60s, right? Um, but it didn't get a lot of attraction from the pharmaceutical industry because it's kind of contradict what they like to do. And it picked momentum specifically in France and Spain. Spain led the way initially, and then got transferred the transatlantic to the US, and we're just getting the hints of it here in Canada. Most of the training that I got is between either Europe or the US.
Oh,
And the utilization of someone's own healing property, whether you can capture it from the blood, is called plasma or platelet-rich plasma, or capture it from the bone is called bone marrow or stem cell. That's the nickname for it. It all works the same concept. It will be the mainstream medicine, but you're gonna go through a lot of hoops and loops with the medical industry, whether it's the pharma industry, because every time we save someone from a hip replacement or knee replacement, the pharmaceutical are not, believe it or not, for those prostheses, the cost of it is about $35,000. That's what OHIP pays the pharmaceutical to get a joint replacement. That's the average cost for it. So if we do it at a lower cost by healing from inside out, means that they're going to go out of business from that part, right? Not
oh,
like from, and often I classify people early stage, middle stage, and latter stage. When you are severe bone and bone, if that's truly the diagnosis, you need the replacement therapy, no problem with that. But often it's get pushed to the intermediate phase. That's where we specialize in. Most of those people don't need it. And if we want to prevent it, we have to work on the wellness within the hormone and gut. So I see this as the future of medicine, having more integrative approach. But I don't see it for the next 30, 40, 50 years because medical boards move very, very slow.
mm,
Even though there's a good financial incentive for medical boards and even our ministries to consider this as the mainstream, because it's going to cost it's going to help them with the cost long term, but you have to implement it now to see the cost of it in 20, 30 years. But often
oh,
politicians don't see it that way. I want to see what I could do in 4-year cycle, not
yes.
in a 30, 40-year cycle, right? 30, 40-year cycle. So I see the mainstream. Our contribution to it is having that integration, having that methodology like spread across the 2 continents right now we're working on. We're making a lot of impact that we got from the UK, and we're getting a lot of attraction in the US. And thank you for giving us this opportunity to voice ourselves in Canada. Unfortunately, even with those awards, Canada's been the last to respond to what we do. And we've seen it with everything. Even the moving of regenerative medicine, Canada is the last to pick up on things.
With that proactive note, because this is fascinating. The way you explained things, it sounds so common sense. It sounds so logical. Even a layman like us, we can relate to that immediately. So in near future, it will also resonate to a handsome amount of people and clients in Canada as well. And with that proactive note, thank you very much for being with us today and sharing these beautiful insights and functional insights to all of our readers and viewers. Thank you very much, Dr. Hawass.
Thank you very much for giving me the opportunity to voice this. Now you're part of that mission is making all those, I don't politicians know about what we do because they're just clients like us. They're going to suffer from something
Yeah,
and that will give them an idea. Hey, can we implement this in our system or not? Right.
yeah.
So thank you for the opportunity.
We will work on that together. Not to worry. Thank you very much, Dr. Hawass. It was a
You're
pleasure.
welcome.
Thank you.
Thank you.